It's been a real pleasure to be here at the UK Oncology Forum today. My talk was looking at lung cancer intra-tumor heterogeneity, but in particular talking about two large longitudinal UK-wide studies called TRACERx and PEACE, not just in lung cancer but in different tumour types, and sharing with the audience in the forum today some of the experiences we've had to date in setting up these studies. Lung TRACERx is a study looking at non-small cell lung cancer, but with the intention of tracking tumour evolution from diagnosis to relapse to death. This involves collecting samples from patients, tissue and blood, and trying to map the course of the disease throughout diagnosis to metastatic disease. And actually, when these patients develop a relapse or metastatic disease of their cancer, we recruit them into a study called PEACE, and PEACE is a national post-mortem programme where we try to collect tissue after death in order to understand better why cancer spreads. I think there's a real need for longitudinal studies like TRACERx and PEACE, and these are only examples, but we need to try and understand how cancer evolves throughout diagnosis, response to treatment, the development of metastatic disease and drug resistance, in order to inform our better management of patients and potentially the sorts of treatments that we can offer them. Setting up longitudinal studies like TRACERx and PEACE are logistically complex, and it requires a lot of oversight and the establishment of big consortia so that teams can work together. And I think that there are various things that need to be considered, and we discussed that today with the forum, from funding, development of infrastructure, to the bringing together of clinical and scientific communities with the intention of understanding tumour biology and disease better so that our patients can ultimately benefit.